health and vaccine availability in Massachusetts. I'm delighted to be joined by Lieutenant Governor Kim Driscoll, our Secretary of Health and Human Services, Kiami Mahania, Dr. Robbie Goldstein, our Commissioner of Public Health, Commissioner Mike Caljo of the Division of Insurance, Undersecretary of Mass Health Mike Levine, Matt Vino, Executive Director of Group Insurance Commission. We also have from the legislature our House Chair Marjorie Decker of the Public Health Committee. Thank you for your partnership, as well as Representative Lawn, Chair of the Healthcare Financing Committee, and Representative Cairns, Vice Chair of Public Health. We're also joined today by leaders from across our terrific healthcare system here in Massachusetts. Laura Pellegrini of the Mass Association of Health Plans, Dr. Ben Krusko of the Blue Cross Blue Shield of Massachusetts, Ryan Abrams, the Massachusetts Pharmacists Association, Val Fleischman and Steve Walsh, Massachusetts Health and Hospital Association, Dr. Olivia Liao of the Massachusetts Medical Society, Kristen Lewis of Point 32 Health, Carlene Pavlos, Massachusetts Public Health Alliance, Walter Ramos, Leading Edge, Massachusetts, Amy Rosenthal of Healthcare for All. I also want to recognize Rich Davey for Massport. Massachusetts has the best healthcare in the country. We do. Massachusetts, we have the best healthcare in the country. We have some of the best hospitals. Our scientists develop vaccines and medicines that save lives around the world. More people in Massachusetts get life-saving treatments, medications, and vaccines than any other state. People in Massachusetts are healthier than people in nearly every other state. And that's because we believe that health care is a right and public health is a responsibility. We've built a strong public health system, as you can see from everybody standing alongside me here today. This is a strong public health system that's backed by science that gets people the health care that they need. Now, historically, we know the federal government has been a partner in this work. Unfortunately, that is not what is happening in Washington. Under the Trump administration, the CDC has been hijacked by people like Robert Kennedy, people who don't believe in science, and people who don't believe in science-based health care. As a result, the government is failing its responsibility to Americans, including Bay-Staters. So we're here to say this is not going to happen in Massachusetts. In Massachusetts, we will not let Donald Trump or Robert Kennedy get in the way of patients and the care and the treatments and the medication that they want and need. So today I'm announcing several steps to make sure that that happens, to make sure that people get the medication and the vaccines that they want and need. So here's what we're doing. First of all, this is something that no state has yet done. Insurance plans in Massachusetts will continue to cover the vaccines recommended by the Massachusetts Department of Public Health, regardless of what any other federal agency or appointee says. This requirement has now been formalized in a joint bulletin issued by the State Division of Insurance and the Department of Public Health. It will cover the full range of recommended vaccines, including flu, COVID, as well as children's vaccines like measles, mumps, rubella, chickenpox, and more. As kids head back to school, and many of our kids headed back to school this week, we want to make sure that they can get the immunizations that they need to stay healthy, as well as our teachers and our families. Our insurance plans are here today. They are here today, supportive, and I want to thank them for their presence and for implementing this work as we move forward. I also want to thank Mass Health and GIC, which is the plan that covers many public employees, for taking the same step to make sure that people are covered. Bottom line, no one in the great state of Massachusetts is going to be denied because of cost. No one. Second, in Massachusetts, CVS, Walgreens, and other pharmacies will continue to schedule and give vaccines, including for the flu and COVID. Now, last Friday, Commissioner Goldstein, at my direction, issued a standing order that ensures that pharmacies can provide a COVID vaccine to anyone who wants it. Essentially, what this means, and the commissioner is a doctor, He wrote a prescription for every Massachusetts resident that covers everyone in this state. In addition, this morning DPH updated its policy so that the commissioner and not the CDC will determine which vaccines can be administered by pharmacists in Massachusetts. I want to be clear about this because I know there is concern. People have been calling pharmacies and not able to get appointments because of changes made by the Trump administration. That changes today, at least in Massachusetts. Because of what we're announcing today, starting tomorrow, pharmacists will be scheduling appointments and giving vaccines approved by the commissioner, and as I say, that's going to start tomorrow. All right, we were just finalizing it, but that's tomorrow. It goes into effect. Pharmacists will be scheduling appointments and administering vaccines approved by the commissioner. I'm grateful to CVS, to Walgreens, and our pharmacies for their communication and their collaboration to make sure this happened quickly over the past week. Third, moving forward, we will do whatever it takes to protect the health of people here and across the country. And that is why I'm announcing that we're forming a public health collaboration with states in New England and across the Northeast. We have been working on this for some time now. We will lead in the development of a few things. First, recommendations for safe, science-backed vaccines that patients, doctors, pharmacists, and health plans can rely on. Second, we'll work to protect and sustain our public health labs, our disease monitoring, our surveillance, and our emergency preparedness. We'll have more to say about this shortly as we move forward, but rest assured, wherever the federal government has created a devastating and harmful gap, we will look to do everything we can to protect the public health of residents in Massachusetts and work with our sister states to stand up and fight for and protect the public health of Americans. People here will continue to get the care and the protection that they need. It's a pretty sad statement that we can no longer trust the federal government on this, but sadly, that's where we're at. We've already seen more than $1 million cut from critical immunization funding, the loss of funding for asthma prevention and education, restrictions on funding for substance use disorder, HIV prevention and treatment, threats and attempts to cut hundreds of millions of dollars more in public health funding, threats to roll back access to reproductive health care, and that's on top of all the cuts that have already been made to food, to health care, to housing, to medical research that are hurting children, hurting seniors, hurting families, hurting public health of Americans across this country. So Massachusetts, we're not going to let this stand. We are taking a stand. We are a health care leader, and we're not going to let the Trump administration or Robert Kennedy cost lives and take us down when others fail to do their job. And that is what is happening right now in the federal government. And by the way, to anyone who supported Robert Kennedy in his nomination, what did you think was going to happen, folks? Okay? So to those who had the opportunity to stop this from happening, shame on you. And to Republicans or any other politician or anyone running for office out there, if you don't take this moment to step up and support public health, there is nothing more core that we do in government than to look out for the health, the safety, the well-being of our residents, our communities, our states. You saw the testimony this morning from our purported United States Secretary of Health and Human Services. It's despicable, it's shameful, it's not right. But I am proud to be governor of a state with great health care leaders, and a state that's always valued investments, not just in health care, but in public health. Because I believe as governor that public health is a responsibility. I'd now like to invite up Commissioner Goldstein. I want to thank Commissioner Goldstein as well as DPH Chief of Staff Emily Daly for the incredible work that they did alongside Gabe Viator, my senior advisor, in making sure that we had a right and ready response to the dereliction of duty by Secretary Kennedy and the federal administration.
At a press briefing on Thursday, Governor Maura Healey of Massachusetts addressed the ongoing challenges to public health in the state, particularly focusing on vaccine policies and their impact on residents. She was joined by several key figures, including Lieutenant Governor Kim Driscoll, Secretary of Health and Human Services Kiami Mahania, Dr. Robbie Goldstein, Commissioner of Public Health, and Mike Caljo, Commissioner of the Division of Insurance, along with other healthcare leaders. Governor Healey began by emphasizing the exceptional healthcare system in Massachusetts, noting that the state has some of the best hospitals and healthcare professionals in the country. She highlighted that Massachusetts residents have access to life-saving treatments, medications, and vaccines, making them healthier than those in most other states. Healey credited the state's strong public health system, which is backed by science, for these achievements. However, she expressed concerns about the federal government's role under the Trump administration, particularly the influence of Robert F. Kennedy Jr. on vaccine policy. Healey argued that figures like Kennedy, who have spread skepticism about vaccines, have led to a weakening of public health initiatives. She pointed out that the federal government's response to public health challenges has been inadequate, and this has resulted in harmful consequences for Americans, including Massachusetts residents. In response to the federal inaction, Healey announced a series of steps Massachusetts is taking to protect public health. The state will ensure that insurance plans continue to cover vaccines recommended by the Massachusetts Department of Public Health, regardless of any changes made by federal agencies. This includes coverage for flu, COVID-19, and children's vaccines such as measles, mumps, and rubella. The state is also working to make sure that these vaccines are accessible to everyone, including children heading back to school. The governor also revealed that pharmacies, including CVS and Walgreens, would continue to schedule and administer vaccines. A standing order issued by Commissioner Goldstein allows pharmacists to provide COVID-19 vaccines to anyone who requests them. This new policy ensures that Massachusetts residents will not be denied vaccines due to federal changes, a situation that has been problematic in other states under the Trump administration. Additionally, Massachusetts is forming a public health collaboration with neighboring states in New England and the Northeast to address the gaps left by the federal government. Healey emphasized that this collaboration would focus on developing science-based vaccine recommendations and protecting public health infrastructure, including disease monitoring and emergency preparedness. The governor also took aim at federal budget cuts that have affected critical public health programs. She criticized the loss of funding for immunization programs, asthma prevention, and substance use treatment, as well as the efforts to roll back reproductive health care access. Healey vowed that Massachusetts would not let these cuts undermine the health and safety of its residents, declaring that the state would continue to lead the way in public health, regardless of the federal government's failures. In closing, Healey condemned those in Washington who have supported the harmful policies of the Trump administration and Robert Kennedy Jr., calling on all politicians to step up and prioritize public health. She stressed the importance of government leaders protecting the health and well-being of their constituents, noting that this responsibility should transcend political affiliations.